Welcome to Gross Anatomy.
Welcome, everybody, to Gross Anatomy. I'm Dr. Jason Cohen.
I'm Raya O'Neill.
Eating a sandwich. And today we have a guest with us, Nicole. What's your last name, Nicole?
I'm Nicole Greenwood. Hello.
Nicole Greenwood, hello. And today it's nursing week. So we're talking to a nurse. We're actually going to talk to two nurses. You're nurse number one, and probably the best, but you're nurse number one, and we're thrilled to have you.
Oh, thank you. That's so sweet.
With us for Nursing Week. We're very excited to be talking to a nurse for Nurses Week.
Yay.
Do you know why it's Nursing Week? Do you have any idea why it's called Nursing Week this week?
I actually don't.
Do you, Raya?
I do.
Why? Why, Raya? I'm grilling you.
Well, it's named after Florence Nightingale. She was a British nurse.
And it's pretty much in honor of her is Nursing Week because of Florence Nightingale. So what's it like being a nurse, Nicole, today in the time of COVID?
You know, it's had its very, very stressful moments. But in that same way, it's also had some really tender, beautiful moments. So it's kind of been a mix of both, as always in life.
Could you tell us a tender and a horrible moment, one of each, if you don't mind?
Sure. Specifically related to COVID?
Yeah.
Yeah, I can tell you that. Oh, yeah. I got some good ones. Okay, so there was a time in COVID in the beginning when there were no visitors allowed. Literally just the nurse was allowed to go into that room. No lab people were allowed to go in. Barely any doctors went in. It was really just the nurses that would go in, do everything for the patient. Not even the aides. No one would go in, just the nurse. This would prevent further risk of infection to everyone else in the hospital if less people are going into that room, because no one really knew enough about COVID at that point. And there was a married couple who came in. The husband was in one of the COVID rooms and the wife was in the other COVID room. And they could talk to each other on the phone. But unfortunately, the wife, her oxygen saturation started to go down really badly, really fast. She became confused and he was calling into her. And I could hear him coughing on the phone, having a hard time breathing, but realizing that his wife was not doing well.
Wow.
And I had to be the person to tell him, unfortunately, we can't talk right now. I got to take care of her. So we got to get off the phone. And that was a really hard moment because he knew, and you could just tell he was terrified. So
wow. How did you take care of them on more than one day, or just one day?
Because I ended up the husband, I took care of him another day, but the wife ended up going upstairs. So she ended up getting transferred to a higher unit of care. Just a little background. I'm on I do medical surgical nursing.
That's exactly. I apologize for not asking you first what kind of nurse you are and where you work and everything. So what kind of nurse are you and where do you work?
I work in South Lake Tahoe on travel assignment. So my assignments are 3 months each time. And
you're a travel nurse. Well, we're going to talk about that too. Well, let's talk about travel nurse. But I want to first finish hearing about this couple. Do you know how things ended for them, or you don't know?
So I don't know. The husband was doing better. His oxygen saturation was more stable. He was able to speak and he was more coherent. She ended up becoming really confused, really hard, really fast, and her oxygen went down. We proned her. We put her on 10 liters of oxygen. For those of you who don't know what that means, it literally means that she was just deteriorating pretty quick, almost to emergency situation. So I had to work quickly to move her to the ICU so she could be put on a ventilator. And she was put on a ventilator later that day.
Wow. So you don't actually know what became of them?
No, unfortunately not. But
that must have been pretty
I was there
devastating.
during the worst moment of their life, for sure.
Wow. Well, I hope they're okay. Well, that's a horrible thing. Well, tell me, was there any good stuff that you saw or witnessed during COVID times?
Actually, some people might think this story is like not a good, it's kind of could be in the sad category as well. But this was also during the time when when the hospital was closed, no visitors allowed, no matter what. This man was a 95-year-old. He had a hip replacement and he got COVID at the nursing home after he was sent there after the hospital surgery and everything. It was a couple weeks later, he got COVID, comes back in and he is not recovering. So suddenly he's on hospice, which is like death care. So we're just doing comfort care for him. And I talked to the daughter that day, and no visitors again. I talked to the daughter that day and she was like, so is it going to happen today? Is he going to go today? You know, what's the situation? I was like,
what do you mean go? Go meaning die? Or
yeah, is he going to die today?
Wow.
And I said, unfortunately, that's not up to me. And unfortunately, I can't say, because whatever you say, it's totally going to be wrong.
Yeah.
So you don't say that. And I said, I'm going to keep in touch with you, though, regardless of however things go. So I would go in the room and, I'd be with him. And we had a moment where I was rolling him over and he, was holding on to me. And I told him, I was like, it's going to be okay. Don't worry. And then he kind of relaxed and I'm pretty sure he was aware he was, going to die. But there were a few hours in between the time that I was able to go back into that room. And I happened to go into that room a little later than what I wanted to. And when I went in, I was only in there for like maybe 2 minutes, and then he died in front of me. And I ended up going to the desk and calling the daughter and telling her that it happened. And she was so grateful that I was with him, because suddenly I was his family in that moment. And I had been chosen to be with him in that moment. So it was really special. She was so grateful that he wasn't alone. And he could have picked any moment to die that day. And he just happened to choose the time that I was in the room with him.
And I mean, it's not enough that it's just Nurses Week. I mean, it should be nurses every single day. I mean, you guys are you're the front line. You guys, I mean, nothing could happen without nurses. And I mean, you're the ones taking care of the patients. You're the family, especially during COVID. I mean, you were probably the only lifeline that these patients had, rather than, other than the doctors running in for a second, if that, right?
Right. The doctors were there as well. They definitely were. And so were the respiratory therapists, which are amazing. And they, unfortunately, I don't think they got enough credit.
That's true.
But the medical assistants also super wonderful. We can't do our job without them. So there are plenty of people that, we definitely, it's a team sport, but in the beginning it wasn't a team sport. There was a time when it wasn't a team sport at all. And it was the one COVID nurse for the day, or the COVID there are travel nurses that are my friends who I spoke to who were in New York City when there was a huge, when the numbers were really high and bad, and they had wings dedicated to COVID, specifically patients. And my friends were exhausted because it was every day they were on this COVID unit, and it was just terrible. And they were still traumatized from it.
Yeah. When you became a nurse, did you ever in your wildest dreams think you would have been doing stuff like that?
No.
Yeah.
No way.
Yeah. And when you became a nurse, so you're a traveling nurse. That means you go around from hospital to hospital taking care of people as they're sick, wherever they need you for the day?
Yeah, so
That was a joke. You didn't, no laugh, no giggle, nothing? You didn't find that cute and funny? What is it?
Literally, I just got off of a 12-hour shift, so
okay. What does it mean? What is it? Because I don't think a lot of people know. I don't think a lot of people know what a traveling nurse is. So what exactly is a traveling nurse? What is that even?
Yeah. So you go on contract and your assignment can be a certain amount of time. You can go and depending on what your assignment is, you can go for a couple weeks. Mine are every 3 months. So every 3 months I move.
I have a lot of friends that are, I mean, you being one of them, but more recently have become travel nurses. if you don't mind me asking, is it better pay than being in a hospital or being in
It is. I'll just say, yeah.
So that's one of the benefits is you get pretty well compensated as a traveling nurse. But what are other advantages to being a traveling nurse?
You get to try. You literally get to
You
go
get to travel.
be in other places that
Yeah.
are so cool, and you get to learn about the culture of the place you're in and make connections with people, but also kind of keep a distance from the drama that happens on the unit, because people working together, inevitably there's going to be drama, and oh, I'm just going to leave in a couple months. It doesn't even matter.
How long have you been doing the traveling nursing thing?
Actually, not too long. I think only like a year or 2 years.
Where have you been? What states or cities?
Mostly California, New York. So I'm licensed in California, New York.
Got it. Where do you like better?
That is a question. Well, from a nursing perspective, there are breaks in California, like really good breaks. Not that there aren't breaks in New York, but in New York, there's the staffing ratios aren't as good, and I'm probably throwing a lot of things under the bus, but yeah, staffing ratios.
So being a nurse in California is better than being a nurse in New York.
Yeah, I would say yes.
I didn't know that. And where do you like, just in terms of geographically, where do you like
living?
Yeah.
That's such a good question. I change my mind on that one all the time, because sometimes I'm hardcore New York and sometimes I'm hardcore California. I'm originally from California, but I am going to say I think I prefer living in New York better.
Interesting.
Yeah.
Because I don't know if you know, Raya and I are both New Yorkers, and we're both now in California.
That is funny.
Yes. What do you prefer, Raya?
I'm still new to the California scene, but I'll be a New Yorker forever. I love New York, but I also am loving California.
Yeah. Yeah.
I actually met Nicole. We met playing beach volleyball in Montauk.
Ooh, on Long Island, New York.
That was 4 years ago now. It's crazy.
I know. It's amazing. That's why.
Nice. When you became a nurse, what kind of nurse did you think when you were going to nursing school or said, hey, I want to be a nurse? Where did you think you would be if you were looking at the future today? Did you think you would be doing this, or what was your plan?
Oh, so I did not think I was going to do this. I thought I was just going to climb. And I wanted to be a nurse practitioner, to be specifically a women's health nurse practitioner. But that's kind of changed a little bit. So I would be open to going back to school and maybe becoming a nurse practitioner for pediatrics or adult gerontology. I've considered it, but yeah, I don't know. Right now, this is feeling really good. So I haven't been motivated enough to go back to school.
Well, that's great. That's great. And would you tell high school you to pursue nursing if you were going back in the past and met high school you?
Question. I would say yes. It's been incredibly rewarding. So rewarding that I've gotten to this point where I would even do it for free.
No way.
No.
Wow.
There's something so incredible about knowing that you changed someone's life, and knowing that you were with someone on the hardest day of their life, and knowing that you brought joy to someone who is miserable. Like, there's some really special, intrinsic, like great, beautiful motivations that are outside of money.
Yeah. Yeah. And you guys really are the rock stars and the backbone of the hospital. I mean, it's, great nursing. That's all you really need. And if you don't have great nurses, it's a whole different ballgame.
Right. And that's the other thing too, is once you become a nurse and you hit this certain level, it really is like the Matrix. Like, you just hit this level of ability, and you can connect to all these other nurses because it's all basically the same. And then everyone, has good jokes, and it's just fun. I don't know how to explain it. There's like an entertaining aspect to it as well.
Good jokes.
Never a dull day. How about that?
There you go. Tell me, what were you going to say, Rhea?
I was going to transition out of the nurse and into the more lively things. When you're not being a nurse, what are you doing?
Me?
You.
When I'm not being a nurse, what am I doing?
Yeah.
Oh, I like to hike. I like to go snowboarding a lot. I live in Tahoe, so there's mountains and there's good snow. I like to play volleyball. I like to do jazzercise. Has been my latest thing.
Cool. Are you trying to be an influencer TikToker?
Not yet, not right now, but
Not
maybe
like
later.
not like I am. So I think we're going to have Ray. I hope Ray is going to join us. He's one of the nurses that I work with in the OR, and by all means, we'd love to have you stay on and maybe meet Ray if he's joining us.
Yeah, sure.
Hopefully, he's going to join us. So it's actually Florence Nightingale's birthday. That's why they made it this week.
Okay, that makes more sense because obviously I know who Florence Nightingale is, but I didn't understand the connection to the date.
The connection, and there he is, and there's Ray. Ray, we don't hear you.
Can you guys hear me?
Yeah.
Now we do.
Hello?
All right.
Ray,
Yes,
meet Raya, not Ray, but meet Raya, who's the co-host of Gross Anatomy, who's a rock star. But you guys are the rock stars, even though Raya's a rock star. And this is Nicole, who's Raya's volleyball friend, who's a traveling nurse. But
Hello.
Ray is one of my rock star, my personal work rock stars. He helps make life easier for me on a day-to-day basis, or if he wants to, he can make it harder for me. But usually he doesn't make it harder for me. Actually, he never does. He always tries to make it easier for me. Ray, how long have you been a nurse, Ray?
I've been a nurse since 1995. That's the time I graduated from nursing school. So ever since then,
So when you were 3?
So no, 1995. I was 20 years old. So yeah, I'm now 47. So that was what 27 years.
Well, you're still a baby. You're compared to me. You're still a baby, Ray. I thought we were a little closer in age, but I'm a little bit older than you. So you have to be a little nicer to me. No, you are always nice to me. So you're not the typical. So Nicole is a traveler nurse.
Hi, Nicole.
Hello.
Yeah, and you do something. You've totally branched out and gotten like super subspecialized. What are you doing these days with nursing?
Yeah, so that's a really great question. Very first thing is that I joined nursing just because I was really sick when I was 12, 13 years old. I was so sick. I had pneumonia at that time, and I was in the hospital for a month. And my nurse, I think that was the reason why I joined the nursing service, because she was really taking good care of me. And she pushed me and eventually pushed me to become well.
And that's what made you become a nurse?
That's what it was.
I'm going to interrupt you for a sec because we didn't find out why Nicole became a nurse. What was your motivation, Nicole?
So I went into it initially because someone inspired me to go into it. Basically, my mom is a nurse and she inspired me to go into it. But aside from that, I was told that I'd make good money and I'd have good job security. So go do that. And I did that. And then I found out that's not the reason you go into nursing.
Right. And there you go. So Ray, back to you. That's a good story. Ray, what about you? So
yeah. So after that, I started in the OR. It's always been the OR. I always loved to scrub, and that was like my little goal in life.
So you started as a scrub tech?
No, a scrub nurse. That time there was no surgical tech. It was just you go to the OR. Either you really have to learn how to scrub and how to circulate. So those are 2 roles in the OR nursing. So from there on, in my old hospital back in Vermont, they trained me when the robotic surgery came into the picture, and it's like, hey, why don't you try and lead the program? And so eventually I did. I kind of help out the hospital there and lead the robotic surgery program. And it started with urology and then the colorectal. And eventually,
Before
I
you
left.
even came to the West Coast, I didn't know you were already a robotic person on the East Coast.
Yeah, I was. So yeah, when I moved to the West, and that was one of the key points that I got hired, because at that time robotic surgery was growing in Cedars-Sinai, and I think when they saw my qualifications and my resume, I was like, oh, this would probably fit, and that's why I got, I started off as a staff nurse in the floor, and eventually I just, because of the program just keeps on getting bigger and bigger, there has to be someone, some figurehead, apparently it was me, to like, okay, have this guy manage it and see how this program evolves. And now look at us now. I mean, from like 500 cases a year to like 2,200 a year.
So I must confess, I thought you were just a floor nurse at the hospital and then an OR nurse and then just started doing robotic surgery. I didn't realize you already had the background in the training.
Yes, I was meant to actually do first assist training, but then this robotic surgery came into the picture, and so I was going to do an RNFA. I was going to join the RNFA school.
What's FA? Father.
First assist.
First assist.
Assist. Yeah. I mean, it's to me. I think if not for robotic surgery, I would probably RNFA or probably go back to school and do med school. I think that was kind of one of the things that, should I go to med school? That was kind of when I was in, like 10 years in nursing. I was like, yeah, maybe I should do it. I'm still early, still young.
So what's your role now? What's your title? What's your role now?
So I'm the robotic surgery specialist at Cedars-Sinai Medical Center, which means that I basically, as you said earlier, make your life easier, right? From making sure that your cases get plugged into the schedule rightfully, and being able to do these cases without hiccups, that you have absolutely all the things you need, from instrumentation to supplies, and not just that, the staffing itself, that I make sure these guys that are doing your cases are actually well trained and provide safe and competent care. And that's why you won't know that before they actually join into do these cases, they go through me. I have to give them onboarding. Like, I had to go through a whole day of we have a full day of training, didactics, how to dock the machine, how to engage the instruments, etc. So they have to go test.
So you're the guy making sure all our robotic cases go smoothly, basically, aren't you?
Correct.
I asked Nicole this. I asked Nicole what she would tell high school Nicole. So if you went back into the past and met high school Ray, you go back to you have a time machine and you go back into the past and you meet yourself as a high school student. What would you tell yourself to do? Would you say still become a nurse?
Absolutely. I think going back, I mean, I would never change whatever have happened to me, and that what had made me right now. I think OR nursing is a different specialty in a sense of being a nurse, because just by being able to give that sense of comfort and sort of security for the patient, because to me, when my patient go to sleep, right, you are their eyes, because they cannot see. You are their voice, because they cannot speak. So you're basically the patient. You're representing them. So when you give that yourself to them, they entrust you in a sense, and that makes, to me, the most wonderful feeling, that now someone really entrusted me their life, that making sure that they're operating on the correct side, for one, and then if there's something happening that during the case, someone would have to speak up, like, hey, this decision is not correct, we have to change this. So to me, going back to the question, I absolutely wouldn't change anything. I would still prefer to go nursing, and I think the route for me would be still the same.
Cool. I'm going to ask you both two questions, and then we could break. And I love you both for being here for Nurses Week, and I love you both that you're taking care of our people. The two questions I'm going to ask you both are, and you can answer them in either order. A, where do you both see yourselves in 5 years, 10 years, 20 years? And then B, try to, if you want to, outdo each other with some type of story that you've experienced or witnessed or seen, whether it's a wacky thing or just an amazing taking care of someone's story. And that's it. And I don't know if either of you have a thought of either of those answers or want to go first or want to go second.
I'll go first.
Okay.
I have no idea where I'm going to be in 5 years. I doubt I'm going to do travel nursing in 5 years. I feel like there's a limit. You can't do this realm, I guess, for so long. So I'm probably gonna be doing something totally different in 5 years. Who knows? Maybe I'll just be a jazzercise instructor and lifeguard. Who knows?
Very cool. Very cool. Ray, what about you? 5 years, 10 years?
So 5 years from now, I'm looking at, on the OR, I would think of having someone to start training the role that I am into. It's about transitioning. It's about passing the torch. So looking at that person to be able to follow and continue the growth and pave the way for the next generation of nurses and surgeons. And because I work closely with you guys, with providers, I work closely with schedulers, with almost everyone. My role, the role that I have, is like the glue to the robotic service. Everyone comes to me, so I want to have that someone to train and be able to provide that continuity in the hopes that, obviously the minimally invasive robotic surgery is here to stay. I thought it was a myth back 20 years ago it started, and I was like, what is robotic surgery? And I just love doing open cases, but now it's not a myth. It's here to stay. Now,
definitely here to stay.
Yeah, but on the other side of it is that I'm looking at, we talked about this. I'm looking at having my own sort of bed and breakfast resort type in Temecula. And I've been constantly looking and getting that right opportunity to be able to just relax there and have my own sort of bed and breakfast and really, because my passion besides this is cooking and entertain, guests. So if I have my bed and breakfast, they would hopefully love my cooking.
Aren't we going to be partners on that?
I would hope so, but
there you go. You better not forget me.
Yeah.
You know what? I want to tell you guys a nursing story that just popped into my head. When I was a med student, on my first rotation, I was doing OBGYN, and the charge nurse there was this old-fashioned, tough as nails, hard nurse. And I think she was probably military. She seemed military. I mean, really rigid. And she used to, there'd be a C-section taking place, and I'd be all excited. I wanted to scrub on the C-section. And she would watch me scrub, and I would start doing the scrub, the way they showed me. And sure enough, I would do something wrong, and she would yell at me and make me stop and start over again. And then I'd start again, and then I'd touch something wrong, and she'd make me stop. And for a few days, by the time I would get into the C-section, the baby would already be out, and I'd miss it because she was so on top of me. But when I finally got it right and I was finally in there doing stuff, she changed her tune from being super hard to knowing, okay, this kid's going to be okay. And then she was all about taking care of me and supporting me. And it was such a cool, I knew she wasn't trying to I'm sure she had some fun with me, but she wanted me to learn properly, and then once she knew I was okay to fly, she was taking care of me. And it was I'm getting a little choked up right now. I wish I knew her name so I could give her a shout out. But she really taught me so much. That's my nursing story.
That's a beautiful story. That has to do with the initiation into medicine, because it really is. These are people's lives. You can't make a joke. You can't mess it up. You better do it right.
Yeah. I'm getting a little choked up. Either
No,
you
no,
guys have a story? Any kind of good, bad, weird, wacky kind of story, or
Yeah.
about being a student?
Not being a for a student, I would.
Anything.
Yeah. So I think one of the things, I think I was probably, this was way 10, 11, 11, 12 years. I got a call to have, to prep a patient um, from the floor to bring to the OR because of internal bleeding. So we got ready quickly, set up the room fast, and I called the floor and like, where is the patient? I was like, oh, it's here. The patient's here. It's like, okay, is it ready? Was the patient ready? It's like, I don't know. So the tone was, the message I got was, there's no hurry to this. And I know it was an urgent case because I know the surgeon, and he wouldn't book a case if it's not, if it's not urgent or emergent. So I went there to the floor by myself, and I looked at all the charts and look at the last, vital signs. And it's all like, the signs are telling me that the patient is going to be hypovolemic, right? It's already there. It's coming. And there was only a clinical partner. I was like, okay, look, let's get these guys rolled up to the OR. I can't wait no longer. And I called the surgeon, hey, I'm gonna roll this patient to the OR, and I'm gonna call the anesthesia because I don't think I can wait any longer. And this is this and that and that. And so I think I made the right decision, because when we got to the OR, he was already bleeding from the inside. It was solely, and so we start giving pack cells. And but again, I didn't blame anyone about it. But the point I'm making is that there were telltale signs, and no one has made that sort of urgency. And I feel that time I was called upon by whoever, the supreme being. It's like, hey, just do it. Someone's got to do it. So I mean, there was it was never be me. Like, I've always like wait, like I always wait with due respect for the nurses on the floor, because I know they do their job. But at that time, there was that sense to me that, hey, go do this, go to the floor. And how many times have you ever encountered a nurse from the OR go to the floor? It's very rare. And I think
you have a sixth sense.
I know, and it was that moment, and even to this day, I said I would still remember, and I even told the surgeon about it. It's like, yeah, that was some crazy night, but I think it hits home. It's something that I would feel that there is really a divine intervention, whoever that divine intervention is. But I think, yeah. So that was my story as from an OR nurse standpoint. Yeah. But I got more, but some of them are depressing. I don't want to do that. But this is something that I think, there's always that supreme being.
Thank you for sharing. Nicole, we're gonna end it with you.
All right, I'm gonna go quick. I have two. So one of them, 37-year-old male heroin addict, was injecting himself everywhere he could inject himself. I was in there with the PA and a nurse's aide, and he was like, wear gloves. You have to wear gloves, gown up, do the whole thing, whatever you can put on, put it on. And so we were going to do an IND, so incision and drainage, which means you pump this bad boy full of pimple poppers. That's basically all you have to know. We go in and we're doing it. And then
what part of the body?
It was like his left glute. So like his left back hip.
Okay. His butt.
Looking everywhere that he could inject something. And I watched the PA put the stuff in, and he did a little incision, and it exploded. And the patient was like, Happy New Year. So
I love that.
Everyone was just laughing because it was kind of light and gross. And
too bad you didn't video it.
And then another one was a scary one. I was working as a pediatric urgent care, and the greatest nightmare of all comes in, which was a 5-year-old who was having an allergic reaction, medical emergency. And luckily, this was my biggest fear. So I had prepared and I had memorized all the epi doses and like told the doctor, hey, we, immediately was like, hey, we got this, blah, blah, spit it out quick. And was like, I'm going to give the epi. And he's like, yeah, give it now. And then boom, gave it. Child started like within 15 minutes, breathing was normal, no longer swelling, like beautiful moment of thank you, medicine. And
you saved his life. You saved his life.
It was great.
I'm sure you've both saved many people's lives. You saved the doctors' lives all the time. And I love you both. I thank you both. I thank all of our nurses. My wife is a nurse. You guys are really rock stars. Thank you so much, guys.
So much. Thank you.
Nurses, you gotta love them.
And there you go. Nurses, you gotta love them. My wife, the nurse, the master injector, we definitely love her.
Love you, Bernice.
Love you, Bernice. All right. Well, thank you to all the nurses for everything you do, not just this week, but every day and every week. And thanks for listening to Gross Anatomy. And thank you to our guests. And Raya O'Neill, thank you.
Thank you, Dr. Cohen.
There you go. Bye.
See you next week.
That's it for this week. Thanks for listening to Gross Anatomy, and be sure to subscribe to our podcast so you can check out more episodes on the evolving sights, smells, and sounds of medicine. Gross Anatomy is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider